Hey everyone, we will continue our cardiovascular system, and today we have part 5, which is blood pressure. What is blood pressure? Blood pressure is the force of the blood that exerts against the inner walls of the blood vessels. So this pressure will produce the units called the blood pressure. And by doing this, then the blood will circulate to the whole body. And when we measure the blood pressure, it's mostly refers to the pressure in the systemic arteries. Remember, the artery is the one that have pressure from the heart muscle that pumping the blood. In the veins, usually the pressure is very low. Even in the vena cava, the pressure is actually 0. So when we measure the blood pressure, we measure the artery, okay, the systemic artery. The blood will move from higher pressure to lower pressure. Remember, the highest pressures will be in the aorta. Okay, aorta and the pulmonary trunk. Because these two bigger arteries where are the first blood vessels that receive blood from the heart. Okay, so the highest pressure will be mostly in the aorta. Again, when we measure the blood pressure over here, okay, using units called the sphygmomanometer. This is a blood pressure cuff. Then you will receive two numbers, 120. So normally 120 over 80 millimeter mercury. So that's the blood pressure unit. Normally 120 over 80. So it is measured by this equipment, okay, a sphygmomanometer. Again, the highest pressure, the one you measure, will be coming from this arterial systolic pressure. This is when the ventricles contracted. So usually give you number around 120. And then the lower number is coming from this pressure, the arterial diastolic pressure. Usually give you around 20. Okay, so this is the highest number, the maximum pressure reached during the ventricular contraction, 120. And when the minimum pressure remaining before the next ventricular contractions give you this 80 number. Okay, so when we measure it again, this is the average number that is measured from healthy persons. So if you see these diagrams, then the highest pressure will be here. This is what we call the systolic pressure. And the lower number will be this one, which is the diastolic pressure. And again, most of this higher pressure coming from the artery. So aorta, for example, and some other arteries will reach the highest pressure around 120 for a normal person, and the lower pressure is 80. So when we move along to the blood vessels, okay, from aorta and then to the artery, then smaller arteries, arterioles, okay, and then capillary, venous, and then vena cava, okay, vein, vena cava, all the way, then you should be able to see that this pressure will be going down. The highest pressures mostly measured from this aorta side, and then in the capillary, the pressure will be going down, and then in vena cava, as I mentioned before, the pressure actually close to zero, so almost no pressure in the vena cava. So when we measure the arterial pulse, okay, we can measure the pulse rate. Again, we're gonna measure it through the artery. Okay, so this is the most common artery that used for pulse rate. Okay, the first one is the radial artery. So when you measure your pulse rate, usually you touch your radial artery. The second one, usually people put it in the common carotid artery on the neck. And there are some other area that actually we can measure the pulse rate, like brachial artery, and then under femoral artery, posterior tibial artery, dorsal spectatus artery, fascial artery, and also temporal artery. So these are the several sites for measuring the pulse rate. There are some factors that influence the arterial blood pressure. Okay, so blood pressure, again, mostly coming from the artery. Therefore, we call it as an arterial blood pressure. So the blood pressure increase, okay, when the blood volume, okay, this is the first factor, okay. When the blood volume increase, then the blood pressure will also increase. When the heart rate increase, also the blood pressure will be increased. When the stroke volume increase, it will also increase the blood pressure. And when the blood is become more sticky or more viscous, blood viscosity increase, it will also increase the blood pressure. And peripheral resistance also will increase the blood pressure. So these are the 5 factors that will increase the blood pressure when these 5 factors increase. Cardiac output. Okay, there are several measurements for the cardiac output. So cardiac output is coming from the stroke volume and the heart rate. So this is the calculation for the cardiac output. What is the stroke volume? The stroke volume is the volume of blood that enters the arteries, okay, which is the aorta and pulmonary trunk with its ventricular contraction. For normal persons, usually around 70 milliliter per beat. So every beat, there will be 70 milliliter blood will be pumped from the heart. Okay, and then the heart rate for normal person is around 72 beats per minute. Okay, so that's the normal heart rate. So if we calculate with time the stroke volume with the heart rate, then we will get the cardiac output, how much blood is actually pumped every minute. Okay, so 70 milliliter per beat time 72 beats per minute, then we get around 5,000 milliliter blood per minute. So about maybe close to 2 gallons of blood will be pumped per minute. So this how much blood will be circulate, will be pumped from our heart every minute, about 5 liters or 2 gallons per minute. Increase the stroke volume and heart rate will also increase the cardiac output. For example, if you perform exercise, the stroke volume and the heart rate will be also increasing. This means that there will be more blood pumped from the heart. So going to be more than 5,000 milliliter, maybe close to 6,000, even 8,000 milliliter per minute, about 2.5 gallon per minute. Okay, the blood volume. Remember, the blood is actually about 8% of our body weight. So 8% of our body weight is coming from the blood. For adults, usually around 4 to 5 liter in female and 5 to 6 liters in male. So male actually have more blood compared to the female. And again, the blood pressure is directly proportional to the blood volume. So it means that mostly male will have higher blood pressure compared to the female, because male have more blood volume compared to the female. Peripheral resistance, this is resistance that coming from our blood vessel wall. Okay, so this is the friction between blood and the blood vessel wall. When the PR, the peripheral resistance, increase, then it will also increase the blood pressure. Vasoconstrictions of the arterioles will also increase the peripheral resistance. So constriction, when the blood vessel, smooth muscle or the blood vessel constrict, automatically it will increase the peripheral resistance, and of course it will also increase the blood pressure. Viscosity, when the viscosity increase, then the blood pressure also will increase. This is due to the increase of viscosity will increase the resistance of the blood flow on the blood vessel wall, and of course it will directly increase the blood pressure. So when our blood is stickier, maybe have more lipids, for example, or more substances like proteins in the blood, then it will increase the blood pressure too. Okay. How to measure the blood pressure? Remember, to measure the blood pressure, we use the sphygmomanometer. And this blood pressure is actually come from the formula, which is the cardiac output time the peripheral resistance. When the cardiac output increase or the volume increase, and of course the blood pressure will be increased. If the peripheral resistance increase, then automatically the blood pressure will also increase. So remember, the cardiac output is also come from the stroke volume, is the volume of blood pumped during the ventricle contraction and the heart rate beats per minute. So when the stroke volume increase, then automatically the blood pressure will also increase. If the heart rate increase, then the blood pressure will be also increasing. So during exercise, for example, our heart rate increase, our stroke volume increase. Then when you measure the blood pressure right after exercise, it will give higher number compared during relaxation. I think we're gonna pass this one. There are some control for blood pressure. This is the hormonal control, like epinephrine. Epinephrine could be hormones and also neurotransmitter. And this is the hormones that can increase the blood pressure. So the more epinephrine produced, then the blood pressure will be increased. So another name for epinephrine is called adrenaline. Okay, so sometimes we hear people that their adrenaline increase. It means that their blood pressure is increased. So this one of the hormones that increase the blood pressure. Peripheral resistance, as we mentioned before, if it is increased, then the blood pressure also increase. Mostly this peripheral resistance increase due to the vasoconstriction, which is the constriction of smaller blood vessel. When the smaller blood vessel dilate, it's called the vasodilation, then the blood pressure will be decreased, because it is the opposite of the vasoconstriction. There are several areas in our body that use as a center for this constriction and also dilation, which is the medulla oblongata. This is the lower part of our brain. It is brain. We have brain stem, and lower part of the brain stem is called the medulla oblongata. It is the place for cardiovascular center. It is the one that controls whether our heart rate, our blood pressure increase or decrease. And because it is the lower part of the brain, then the control will be automatic. So this is part of the autonomic nervous system, the one that controls our body automatically. Okay, this diagram showing us the control for the cardiac output, peripheral resistance, and also, of course, control the blood pressure. Again, the control center is located here. In the area is called the medulla oblongata. Okay. So let's say this is the normal blood pressure. Okay, 120/80. Okay, when the blood pressure increase, okay, so increase in blood pressure, and there are several areas in our body, especially in the arch of the aorta, will receive that information. So there is a receptor that will sense the increase of the blood pressure. And this receptor will send the information to our control center. And then our control center will send the neurotransmitter or response to our effector. Okay, in this case, because the blood pressure increase, okay, so the response should be decreased. So this is what we call negative feedback system. Okay, negative feedback system. Okay, when the pressure increase, then the response will try to decrease that pressure to reach this normal blood pressure over here. Okay, so there are several effectors that will get the order from this control center, okay, CV center. The first one will be the blood vessels smooth muscle. So it will dilate and it will decrease the peripheral resistance. The second one will be sending, okay, the control center, the CV center will send the informations to the heart, okay, especially to the SA node. So the SA node then will relax, okay, will slow down the contraction. And then at the end, both of these vasodilations and slow contractions in the heart muscle will decrease the blood pressure, and then it will be going back to the normal pressure. So this is when the blood pressure increase. Now, what happens if the blood pressure decrease? Okay, like maybe during winter time, sometimes our blood pressure decrease. Then the same thing happening. So this one, the stimulus decrease, right? And our response is try to increase it to go back to the normal pressure. This is also negative feedback system. Okay, so when our blood pressure decrease, then the receptor, like in the blood vessel in the aorta, will receive or send that information, and then send that information to our control center, CV center in the medulla oblongata. And medulla oblongata will also send order to the smooth muscle on the arteries, okay, on the blood vessel, increase. So it's going to be vasoconstriction over here. It will increase the peripheral resistance. And at the same time, it also send the order into the heart muscle, and the heart muscle will increase the contraction. And then when the cardiac muscle contraction increase, both of these vasoconstriction and increase the heart rate will increase the blood pressure, and then it will return the blood pressure into normal at 120/80. So this is how our body control the blood pressure within normal range. If it is increased, then our control center will try to decrease it. If it is decreased, then our control center will try to increase it to make it return to the normal blood pressure. Okay, so this is the same thing. The left side over here, when the blood pressure increase. Okay, so when the blood pressure increase. Okay, so this is the stimulus. The blood pressure increase. Then the baroreceptor will receive that information, sense that information, and then it will send the information to the cardiac center. Okay, and then the informations from the cardiac center will go to the heart. So the heart, this is going to be parasympathetic. This is the one that will relax the heart muscle. Okay, so the heart rate will be decreased, and then the blood pressure will return to normal. So the stimulus increase blood pressure, then the response is try to decrease it to take this blood pressure into the normal rate. Okay. On the right side over here, okay, when the blood pressure, this is the peripheral area. Okay, so the same, the stimulus is increased, and there are some baroreceptor in the aortic arch and carotid, common carotid artery that will sense that information. Okay, and then it's sent to the control center, and then control center will send the information to smooth muscles of the arteries, and this smooth muscle will dilate. So it's called the vasodilation. It will decrease the PR, peripheral resistance. Then at the end, it will also decrease the blood pressure into the normal rate. Okay, so this is on the the left one over here is the control for the heart. Okay, and the right side over here, control for the smooth muscle of blood vessel, which is the peripheral resistance. A clinical application for this blood pressure is hypertension. So hypertension is high blood pressure above normals, and this is long-lasting elevation of arterial blood pressure. It's not only one time, like for example, when you do exercise, of course, your blood pressure will be increased, but this is only temporary. For the hypertension, this increase of blood pressure is long-lasting. Some causes are unknown, okay? Some due to increase of sodium intake, psychological stress that activate the sympathetic nerve. Like for example, if you get angry easily, that sympathetic nerve will kick the heart rate, and because of that, then the blood pressure will be increased, and this can cause this hypertension. Some disease like kidney disease can also increase the blood pressure and causing the hypertension. The hypertension is also known as a silent killer because it might not cause any direct symptom. And sometimes many of these hypertension can also contribute to the formation of atherosclerosis, which is the build-up of lipids on the blood vessel wall. And it can also lead to the coronary thrombosis and embolism, okay, breakdown of the blood vessel. Cerebral thrombosis, embolism, hemorrhage can also cause by this hypertension. Prevention, healthy diet and weight control, regular exercise, limiting sodium intake. Some treatment include diuretic treatment and sympathetic inhibitors. Now we're going to talk about the venous blood flow. Okay? Just remember, venous blood flow is very slow because this veins lumen is actually bigger than the arterial lumen, and also the pressure on the vein is considerably very, very low, even zero in the vena cava. So the venous blood flow only partly as a direct result of the heart action. So when the heart pumps the blood, it has to go to the aorta, and then smaller artery, smaller artery, and then arterioles, many capillary, and finally go to vein. So vein actually receive very low pressure from the heart. And then these veins combine to make vena cava. At the end, vena cava will get about zero pressure from the heart action. So therefore, okay, in addition of this, mostly the blood flow in the veins is coming from the skeletal muscle contraction. So when we contract our skeletal muscles, when we perform exercise, it can increase the blood flow in the veins. Okay. Also respiratory movement, okay, during inspirations, thoracic cavity enlarge, pressure fall below the abdominal pressure, then it helps blood flow back to the heart. So exercise, for example, will also increase the our respiratory or breathing rate, and it can also increase the return of blood to the heart through these veins. And then vasoconstriction of vein. Okay, under condition of low blood pressure, sympathetic reflex can also contract the smooth muscle of the vein. So these are the main actions that return the blood from the vein to the heart. And again, mainly it is coming from the skeletal muscle and from the respiration. Okay, if you see over here, this is the diagram how the skeletal muscle, like for example, skeletal muscle in our leg, push this blood up. Okay, so especially for the lower blood vessels in our legs, they need a lot of action or contraction from the skeletal muscle. So doing exercise, being active is actually help us to return blood, especially in the lower part of our body, to the heart. So when it is contracted like this, then the valve will be opening, open, and then the blood will flow. When this muscle relax, then the valve will be closed. It will prevent the blood from going down to the lower vessel. Okay, so this is the muscle contraction that will increase the blood flow in our vein or vena cava. For the central venous pressure, so L vein, okay, all vein except those returning to the heart from the lung. So we are not talking about the pulmonary vein. We're talking about the vein that coming from systemic circulation, which they will all enter into the right atrium. And this is what we call the central venous pressure. So this mostly coming from superior vena cava and inferior vena cava. Okay, the one that coming from the heart, the coronary sinus is really short, so they are not considered as a central venous pressure as well. Exercise and the cardiovascular system. So exercise is good for the heart. It will increase the heart rate. It will increase the stroke volume. It will also increase the delivery of oxygen to many organs in our body. But it has to be a regular part of life. It's not only one time per month or per year. It has to be regular exercise that can increase the healthy of the heart, and at the end it will increase the cardiovascular system. And again, some benefits of exercise: it will increase the pumping efficiency of the heart, increase the blood volume, increase the hemoglobin concentration that carry oxygen, and increase the number of mitochondria. So that's some benefit. The heart might enlarge 40% or more. Okay. Of course, the stroke volume will be increasing, and the heart rate and the blood pressure will decrease, okay, for a long-term exercise. For an exercise that benefit cardiovascular system, the heart rate must increase to 70 to 80% of maximum. Must last about 30 to 60 minutes, at least 3 to 5 times a week. So this is the type of cardio exercise that will benefit the heart. I think that's all for this part number 5. We'll go to the last part, which is part number 6. See you later. Goodbye.